initiating IV therapy. First, you're going to review your physician's orders and make sure you have the right kind of medication fluid or IV fluid that the doctor is ordering. You're going to check the purpose of this infusion, the fluid that you're going to give, and of course follow the 6 rights while you're at your mark. You're going to check your patient's name, the medication or the IV fluid, the dose, if it's a 500 milliliters or a liter, whatever it may be, the type of fluid that it is, the time of the infusion, make sure you're hanging it at the right time, and the right route. It is a IV solution, and I think I named all of them. Okay, then you're going to assess your client for any conditions that are going to prevent. You're going to see, do they have any problems with edema? Is their hand swollen? Is it poor perfusion where you're going to start the IV? Is the client having any symptoms such as tachycardia or wet lung sounds? You know, do they have crackles or rhonchi? Do they have good turgor? So you're going to check their turgor. Are they nauseated? Are they vomiting? Do they have an increased thirst or decrease in urinary output? And then how's their capillary refill? And we're going to see what their preference may be. If they're right-handed, they probably want it in the left hand. So ask them whatever their preference is. Okay. You're going to ask them also, what was their previous experience? You're going to say, have you had an IV before? And they said, oh yeah, once when I was in the hospital and I had my child. Okay. Well, then you're aware that you're going to get a little stick and we're going to start an IV. And they say, okay, that's fine. So this client says they don't have a preference, so we can put it in either hand. You're going to also make sure that you look up your medication in your drug reference book, or ask the pharmacist about any incompatibilities of anything that the client may be receiving, and what signs and symptoms you need to watch for any side effects of whatever you may be providing to the client. Also, if this is a client that's going to be going to surgery, then you want to use a larger gauge angiocath, because they may be getting blood products, so they may need to infuse large amounts in a short period of time. So therefore you would put in a 18 gauge or higher. Remember, the higher the number, the smaller, the lower number, the larger. Okay. We're going to check their labs. We're going to check them for any allergies. See if they have a latex allergy or any medication allergy, any iodine allergy if you're going to be using iodine, anything like that. And then you're going to go in and explain, of course, do your standard steps. You're going to wash your hands, ID your client, educate them on what you're doing. Okay. Make sure your client is comfortable. Also, it needs to be comfortable for you, so you want to make sure that it's the bed is up at a good working height for you. Save your back, remember. Organize your equipment, so you want to make sure that you have everything at the bedside and it's all organized. Make sure your lighting is good. You want to look at what kind of gown your client has on. If you have the snap top at the shoulder, that's good because it's easy access. You can just unsnap it. You won't have to pull the client's arm through the gown. Then we already talked about you're going to inspect your fluid. So you're going to look at your IV fluid. We did this out at the cart. We checked our solution for color, it's clear, clarity, and the expiration date on it. So each of them have an expiration date, so you want to make sure you check for that. Then you're going to, this bag is already spiked, but you will pull the tag off here, insert your spike into your bag. You're going to open up your clamp. Okay, wait a minute. First of all, I'm going to have my lower clamp off. Then open up my clamp, and I'm going to feel my Buretrol, and then I can open my lower clamp in order to purge through my tubing. Making sure that at each port, you turn the port as the fluid is coming by, you turn it upside down and get the air out of the port. Because later you may be given medication through those ports, and you don't want air surging in the ports. Okay, so you purged it all the way through. Okay. Then basically it's saying to make sure that you maintain aseptic technique by not touching the spike or the end of your tubing. Already talked about priming your tubing, turning it on and off, making sure there's no air in it. And then we're going to have a lock infusion, infusion for us to flush with, syringe for us to flush with. Okay, and this one already has an extension set on it. Anytime you can, try to have an extension set on your tubing. So we added on this extension set, and of course purged all the way through this. The reason for that is because as you are changing your IV site, you don't want the weight of the tubing right at the site. Okay. Then now we're on the back on step 16. So you're going to apply your gloves. If you feel you're going to be splashing, then you can put on goggles because you want to protect your eyes. So if you feel you're going to have any splashing of blood or anything like that, feel free to put on goggles or even a mask if you would like. Okay, so now I'm going to identify any accessible vein. So I'm going to look at the veins that my client has, and you want to start more distally. So we're going to start distal and work up. Hopefully you'll get in first time and you won't have to worry about his forearm or anything like that. But we're going to start in his hands, and we're going to look at the IV sites that we have. So about 4 to 5 inches, 4 to 6 inches above the site. So I'm going to start here. You're going to apply your tourniquet. Okay. And not to the point of pain. I see sometimes people apply a tourniquet so hard to the point of pain. It doesn't have to be to the point of pain. But about 4 to 6 inches above your site, because you don't want bruising or anything like that. If you have a very fragile client, you can even put this tourniquet over a thin layer of clothing to protect their skin. Okay, and then you're going to select your vein using your thumb to pull down on the vein, and you're just going to feel the vein for resilience. Does it bounce back? That means once you push down on the vein, it should give you a nice bounce under your finger. And that's a skill that you'll have to develop to get your fingers nice and sensitive to the feel of veins. Because sometimes you'll feel them and they'll feel hard because they've used those veins over and over again. So that's not one that you would use. You will go up a little bit higher. Okay? All right. So once we've discovered our site, then we're going to release the tourniquet. Let it relax a little bit. Okay, and we're going to, if you want, you could provide a local anesthetic at this time. Okay. And now we're ready to clean our site. Now make sure that your IV tubing is nice and close to you, because you'll be ready to insert it once you get your IV in. Let's see if I can put it up here if it won't fall. Okay, good. That's good. Stay. Okay. So now I'm going to reapply my tourniquet. Remember, 4 to 6 inches. And in a way that you can just easily release it. Okay, now I'm going to clean my site. Vertically and horizontally, and then in a circular motion. Starting from where you want to insert and then going around, and allow that to air dry. And you're never supposed to fan your site. You're actually supposed to wait for it to air dry on its own. And this is just like with your IM injection. You're always going to insert the needle bevel up. Remember, we talked about how that bevel has been formed so that it's sharp. It's a sharp, just like a scalpel, so that it slides and glides easily into the skin. Okay. You're going to hold down your site, and you're going to insert at a 30-degree angle. Okay? You should get a flashback. Okay? You're going to pull back your, and you're going to advance your catheter. Okay? Good. Good. You're going to secure the hub of your catheter, and you're going to connect your IV tubing. And release your tourniquet. I didn't do too bad. I didn't get too much all over. Okay. And open up my IV tubing, and hopefully I get a nice flow. Okay, good. Now you're ready to secure your, I'm going to protect right under the hub. Add on an anchor. You're going to find the tape is not going to stick very good to the mannequin. It's kind of long. Quite not that much. Don't fool around and pull it out. Okay, maybe I'll use my scissors. I don't know why the tape isn't sticking here. We're using something on it? Okay. Hold on, let me get my scissors. I want to cut it down. Can't stand for that to be that long. Okay, so we did all of that. You're down to 23, where you performed the venipuncture. Told him that he was going to get a little stick. You insert it at a 30-degree angle. You watch for a blood return. Talks about where the hub of the catheter angiocath should rest. It should be all the, you want to try to get the hub up to the skin level. This side. Okay, and then I'm going to put my transparent dressing on. Then you're going to remove this outer piece. Now some people just put the anchor and not the tape, but I like the tape underneath to kind of keep that up off the skin. And I guess to each his own. Okay, so we already stabilized it. We threw away our stylet. We started our infusion. Secured it. We put on the transparent dressing, put on the chaperone, and then what else? Or it tells you you can put a gauze dressing. If you were going to do a gauze dressing, you would do this piece and then a piece of gauze on top and secure that with tape. If you were going to do just a gauze dressing. And then it tells you to secure your tubing further up on the arm. Add one more piece. And that's just so that it won't pull. Make sure it goes down close to the side of the tubing. So you actually are like pinching the tubing up in it to secure the tubing. Okay? And then I have my date and time tape already done. Let's see if I can stick it underneath here. You can put it on the side. And the size of my angio and my initials. And I'm going to make sure that my IV is flowing, that it's dripping, or if it's on a pump, that it's set at the rate that it was ordered at. And I'm going to make sure I dispose of everything. Remember, anything that's not a needle, don't put it in your biohazard container. Just throw it in the garbage. Clean up. Do my hand hygiene. Ask my client, how does it feel? Is it painful? Do you have any problems? She states no. And then every 72 hours, we're going to come back and change this peripheral access every 72 hours, where you're actually changing the IV. If it gets wet or something, you may change the dressing, but you're going to actually change the IV every 72 hours. And then you're going to make sure that any client you have that has an IV, every 1 to 2 hours, you're going to come in and you're going to check their site. You're going to go all the way back, make sure that there's no kinks in the tubing. You'll check what's in your buretrol. You'll check your drip rate. You'll make sure everything is fine. When you get down to about 100 left in the bag, you're going to prepare the next bag and have it ready so that whether it's you going back in there or another nurse, that you hang the next bag. Okay, and then evaluate your client's response. That's it.